It's the Metro on WDET. I'm Robyn Vincent. In 2022, Michigan voters wrote reproductive rights into the state constitution. Planned Parenthood of Michigan had 14 health centers then. Today, it has 7. Planned Parenthood says it sees nearly 60,000 Michiganders a year. And of the 3 centers that closed at the end of July, none of them performed procedural abortions. They closed on a single day: Lansing, Livonia, Warren. The Ferndale clinic is still open. That's because Oakland County commissioners voted last week to spend up to $1.5 million to keep it operating through 2028. Ferndale is in my guess district. Mallory McMorrow is Majority Whip of the Michigan Senate. She spent the past year running for the U.S. Senate and suspended her campaign a month before the primary. Senator, welcome to the Metro.
It's so good to be here. Thanks for having me.
I want to start with last week. So again, Oakland County commissioners voted 11-6 to spend up to $1.5 million to keep the Ferndale Planned Parenthood open through August 2028. That clinic is in your district. Do you know what that money covers?
I do. So it is a reimbursement for patient visits. So it's something like $263. Forgive me if I get the figure slightly off, but per visit. So it's not just one award to the clinic. It's really to make sure that as any of our residents go to seek care, that care is covered and that the providers are paid for. And I really appreciated that you opened by discussing what Planned Parenthood is, that a lot of these clinics that closed did not even provide abortion services. I was a Planned Parenthood patient myself when I was in college, just to get access to contraception and to have regular checkups. And it is a lifeline for so many people. So in a moment where Planned Parenthood is at risk and healthcare is at risk, I really want to commend local leaders for stepping up and recognizing that this is healthcare and our residents deserve access.
I mean, I can imagine some people listening are thinking that Planned Parenthood is simply a health clinic, and Michigan has plenty of those. And you're saying that it fulfills a bigger service than that.
It does, particularly for women. There is such a gap in healthcare access for women's needs. Meeting with a provider who understands the complications of long and sometimes painful periods or going months at a time without a period, being able to ask questions about reproductive health in a way that you wouldn't necessarily be able to at a clinic or an urgent care where it's kind of this churn and burn in and out. It is really complicated to be a woman, to decide if and when to get pregnant, and that even if you are pregnant, there are so many ways that a pregnancy can go wrong, and Planned Parenthood is there to fill that need for women's health.
I want to go back to what you mentioned, being a patient yourself in college.
Yeah.
What struck you about the care that you received at the Planned Parenthood you went to?
You know, it was scary at the time as a young person who had spent my entire lifetime seeing my pediatrician before I went off to college. I went to Notre Dame. And I remember in my freshman year, my contraception had run out. So I went to the school health clinic to get it refilled, and they refused to do it as a Catholic school. I remember going in front of some of the providers, and they had given me paperwork that they asked me to sign that I was going to promise that it was for medical reasons and not for being sexually active. And it felt so invasive when I had a prescription. I had a doctor who had already seen me and prescribed this, and I just felt so ashamed. And I had debilitating periods in my teenage years. So I ended up with a 1.9 GPA my first semester in college because it was so bad that I would go for a month without going to class because I was so uncomfortable and I had headaches and I was nauseous and I would stand up and I would get dizzy. And it was finally a friend who said, just go to Planned Parenthood. And, you know, I sought it out and I showed up and they were just so kind. And it was such a contrast from feeling like I was judged for being a woman to just have somebody who was there to answer questions and refill my medication and put me back on a path to living normal life. and going to class and not being debilitatingly uncomfortable. And it was the first time after that experience in college where I felt like they treated me as a whole person and not less than. And I know that so many women go through that experience of feeling like this should be healthcare, and it feels in some ways like I'm a second-class citizen, and Planned Parenthood was such a different experience in the best way possible.
There is some incongruency here because I think that there are a lot of people who are hearing what you're saying, particularly women, and they're nodding, and they may have had similar experiences. And Michigan voters put reproductive rights into the state constitution 4 years ago. In that same stretch, Planned Parenthood has gone from 14 health centers to 7, as I've mentioned. How do you account for both happening at the same time?
You know, it was a fascinating experience over the last few years. I have been very active in all of our election cycles, whether I'm on the ballot or not. So in 2022, I vividly remember the day that the Dobbs decision came out. And I was actually in the middle of doing a live stream for my district, legislative updates. And even though we knew it was coming because we had seen the leaked decision, I just started crying because I couldn't believe this had happened, that, decades of precedent were stripped away from us. And I went to a protest at Palmer Park later that day. And there was something really empowering to realize that compared to many other states, I'm friends with legislators in Oklahoma, for example, and we were in a group text. And in some states, there was nothing they could do. And for us, we were in a very different situation. We had this ballot initiative. It hadn't been circulated very widely yet. And I remember standing in a group of dozens, maybe hundreds of people who had come out and said, we can do something about this. And there were so many people who had never collected a signature for a ballot initiative who were asking for 5, 6, 7 sheets and wanted to go out and make this happen. Prop 3 collected more signatures than any other ballot initiative in state history and passed with overwhelming majority. 67% of voters voted on Prop 3 to codify not just abortion, but reproductive rights as a constitutional right in our state. And then in many ways, as we headed into the 24 election cycle, I remember talking to voters for our state house candidates. I was a surrogate on Vice President Harris's presidential campaign. And it felt like to a lot of Michiganders, we did that. It's done. This is a right. And people had moved on in many ways. And unfortunately, what we're seeing now, it is the compounding impact of H.R. 1, the so-called One Big Beautiful Bill that has forced us in the state legislature to have to backfill Medicaid funding, to have to figure out how to fund work requirements for Medicaid and for SNAP. I think Oakland County, Michigan Work shared with me that they've seen appointment requests to fulfill the work requirements skyrocket 6,000%, and we have to fund that. And we are now in a situation where Planned Parenthood lost this funding, and we are seeing now the devastating reality that just because it's a right doesn't mean you can access it. You have to fund it. You have to pay for it. You have to have the infrastructure in place. And again, tremendously grateful for Oakland County for recognizing that. But as we move forward, I hope this opens up a broader conversation to say, how do we ensure that a right is actually a right?
You're saying that a lot of the weight now has to be carried by local municipalities, by state legislatures. I mean, you've sponsored a state version of the FACE Act, protecting patients and providers at clinic entrances. You've sponsored bills requiring insurers and Medicaid to cover long-acting birth control right after childbirth, before a patient leaves the hospital. Those are laws about access, about what a patient is entitled to and who can stand in the way. When you and your colleagues were writing them, how much of the conversation was about the money that keeps a clinic's lights on?
It all goes together. We took a hard look at all of the gaps in access. And this has been an issue my entire time in the legislature that I have focused on. I think we all bring our own lived experiences into this job, and I'm no exception. We also left the door open for people to share their stories, and hearing from some clinic owners who shared that there were anti-choice activists who would break into the clinics, who would harass patients who were sitting in the lobby inside the clinic and terrorize people. And it in the absence of federal legislation, as we see not only with Dobbs, but in all of these rights being eroded, the Federal FACE Act, there was legislation on the federal level to repeal that. So this was an effort to put a state level FACE Act in place. But it all goes together. So there's the policy gaps that exist. I also had legislation to require Medicaid funding within the state be eligible for abortion services.
Which we still do not have.
And I represent in the state Senate the most diverse district in the state. It's Northwest Detroit through Birmingham. It is diverse by race. It is diverse by age. It is diverse, I think, most importantly, by economics, by your salary, your income. I represent some of the poorest communities in the state. I represent the wealthiest community in the state. That lack of access, that you are only eligible to have the full scope of care if you are wealthy enough, to me is wrong. Because for so many people, again, I go back to all of the stories that I've heard of the many ways that a pregnancy can go wrong. I think too often abortion is demonized. And what we know is, no woman is waiting until late in their pregnancy to decide to have an abortion. It's just not reality. It's not how it works. But there are instances where a healthy pregnancy can go very wrong after 20 weeks, and it's devastating. And it should not be determined by your income whether or not you have access to care in that situation. So all of these things go together. There's the policy gaps, and every single policy has a price tag. But we are in the devastating position right now of the domino effect. As federal funding is cut, as work requirements are put into place, people keep coming to the state to ask the state to backfill it. We did as much as we could in this last budget cycle to mitigate as much damage as we could, but the state of Michigan can't run a deficit like the federal government can. We have to pass a balanced budget, so then the domino goes down to the local level. And Oakland County is a county that has the means to do that. And I'm glad that they did. But I think about the communities that don't. And as I've spent the last year traveling the state, I think a lot about rural communities who don't have the funding, who don't have the resources, who lack access to care now because a clinic is closed.
I do want to think about that, about how this is going to disproportionately affect certain counties based on what they have in the coffers.
Yeah.
But I also want to think about the other side of this. I mean, over the past decade, I think one of the critiques of Planned Parenthood is that it leaned into progressive activism, organizing via Generation Action, voter registration drives, and rallies in support of reproductive rights. In doing so, some could argue it made itself vulnerable to people on the political right, people who want to cancel it if they could get the chance to do so. Do you think that's a fair perspective?
Yes and no. It is such an interesting organization because it's kind of trapped in this gray area of being a medical provider, but a medical provider that also provides abortion care, which has always made it a target of the conservative right. So I think because of that, the question, and I've talked to a lot of Planned Parenthood leaders over the last decade, is what do you do? I know that there was a leadership change probably about a decade ago where they did start to focus more on the other care that they provide. But it is one of the only organizations that provides the full scope of care. So it left that aspect of, if you do need abortion care, it left that vulnerable. So it's always been in sort of this tricky place. But what I saw happen with Roe is, so long as Roe was in place, the conversation was at the extremes. There were people who called any of us who are pro-choice baby killers. And then the perception of pro-choice activists was it's abortion on demand. And once Roe fell and there was no longer this backstop where you could talk in the extremes, all of a sudden it opened up the floodgates. And we saw this with conversations on the doors around Prop 3, where people who would consider themselves, I'm Catholic, so, potentially as somebody who's deeply religious and personally opposed to abortion, I would hear on the doors, they would tell stories of having an ectopic pregnancy, losing a pregnancy, having a friend, a family member, a daughter, an aunt have a complicated pregnancy. And it opened up this dialogue that I think we've needed to have for a long time, to recognize reproductive care is complicated and it's not black or white and there's no easy answers. And that is where I think this conversation needs to live, that even if you personally feel like you would never pursue an abortion, you want to know that if your daughter has a complicated pregnancy, that she's going to get the care that she needs. And I hope that's where the conversation can stay. And it's really going to lean on people telling their stories, care providers to talk about, at this Ferndale clinic, all of the care that they provide. Me telling my own story. There's a reason that I've always been so candid about this, is because I want people to know, when I found Planned Parenthood, they treated me like a person, and everybody deserves that.
Last question for you on this. I do want to go back to counties.
Yeah.
And the disparities in terms of wealthier, affluent counties and poorer ones. I mean, I'm thinking about Wayne County, which is bigger and poorer than both Oakland and Washtenaw counties, which both have put up the money to keep clinics open. So with that in mind, what should the state legislature be doing right now to ensure that vulnerable people are getting the kind of access that they need when it comes to reproductive care?
It's a conversation that we have every day. Sarah Anthony, who's our appropriations chair in the Senate and a dear friend, we've had long, hard conversations about the realities that we face in the legislature with funding. So that will be ongoing dialogue, is how do we ensure that nobody is denied care based on their income? And it's also going to require advocacy. This is a midterm election year. We need federal officials to reverse the damage of H.R. 1, the One Big Beautiful Bill, to put funding back in place so that the state doesn't face that domino impact, so that local municipalities don't face that domino impact. And we recognize that basic care is something that needs to be funded.
It's the Metro on WDET. I'm Robyn Vincent. My guest is State Senator Mallory McMorrow of Royal Oak, Majority Whip of the Michigan Senate, and until July, a candidate for the United States Senate. We've been talking about the Planned Parenthood clinics that have closed in Michigan. We're going to take a quick break, and we will then continue this conversation and discuss why Senator McMorrow decided to suspend her campaign. Stay with us. It's the Metro on WDET. I'm Robyn Vincent, and my guest is State Senator Mallory McMorrow of Royal Oak. We've been talking about the Planned Parenthood clinics that have closed in Michigan, and now I want to turn to your U.S. Senate campaign that you suspended a month before the primary. You said at the time that you were not leaving the fight, but you didn't say why you were getting out. Why did you get out?
First, I don't want to lose sight of the stakes here. We're past the primary, and the contrast could not be clearer in November, where we've got Mike Rogers as the Senate candidate who, on the Republican side, who opened the floodgates to opioids in the middle of the opioid epidemic, who made more than $10 million for himself after getting out of Congress and selling his influence, who was one of the primary architects of the Patriot Act at a moment where I know people are deeply concerned about flock cameras and government surveillance and what that means. So I want to start there. And I will have a lot more to say about the primary after November. But I want to say to everybody, it was an incredible experience. I knew coming in to the race that I was going to be the dark horse. I'm a state senator running against two candidates who had a lot more experience at the federal level and statewide. I had a huge name ID gap to close, and I went from trailing in the polls at the very beginning, something like 10, 12%, to, for a long time, the front runner, and had outraised the field with no corporate PAC donations. I had more small dollar donors than my opponents combined. But it was a three-way primary, and it's tough. So I was somewhere in the middle of my two opponents, and that can either be the lane that appeals to everybody, or you can get squeezed out. There was a record amount of outside spending in this race. It was the most expensive Democratic U.S. Senate primary in our country's history. And, you know, I just had to take a hard look at where we were and what the gaps were and make the right decision, not only for me, but for the stakes in November. Because it was a really ugly primary, and having lived through that, I can tell you that. And I wanted us to be very clear-eyed about the path forward. I recognize that this time there probably wasn't a path for me to get my message out and succeed, but I am singularly focused on staying in the fight and making sure we give voice to critical issues like we've been talking about all show, and to really recognize the stakes here. You know, I am 100% behind Abdul. I was with him at his press conference the day after he won the primary, and we have to beat Mike Rogers. We have to make sure that Democrats have a chance at flipping the Senate.
I want to point out, we have heard quite a few Democrats talk about Mike Rogers on this show, and we have an open invitation to Mike Rogers to join us here. So I want to, again, remind Mr. Rogers that we would love to have him on this show so that he can talk a little bit about his campaign. Back to yours now. Let me ask you this. Your name was already on the ballots when you suspended your campaign. Absentee voting was underway, so it stayed. You finished with more than 61,000 votes. Dr. Abdul El-Sayed beat Haley Stevens by less than 15,000. You had promised to endorse the winner the moment the race was called, and you did. You endorsed El-Sayed. Why that timing? Why not endorse someone sooner?
Because the stakes in Michigan are November. You know, I recognize that for me, we had internal polling that showed this. There was public polling that showed that my supporters tended to split evenly between both Abdul and Haley, which meant that I've kind of got the ability to talk across the Democratic Party in a way that I recognize is valuable. And there are a lot of people, I know how these races go. If your candidate lost, it can be really hard, especially if you were not only a voter, but if you were a supporter, if you knocked doors, if you put time into supporting your candidate and they didn't make it through, that is really hard to turn around and say, oh, now I'm going to support somebody else. So I knew that if I could put my weight behind the nominee for the general and keep the door open for my supporters to reach out with questions, for Congresswoman Stevens supporters, if they feel comfortable to reach out to me with questions. I just relaunched my Ask Me Anything series on Instagram, and I love that people can ask questions anonymously. And I'm going to answer to say, if you have concerns as we head into November, let's talk about them and let's talk about the stakes, and that is a role that I can play that is going to be more powerful than had I gotten involved in the primary after I dropped out.
Elizabeth Warren and Chris Murphy had endorsed you.
Yes.
Polling in mid-June had you around 6%. On the day you got out, Dana Nessel, an ally of yours, endorsed Haley Stevens. And there's been reporting that you were under pressure from party figures to clear the field. How much of that is accurate?
Nobody ever asked me directly to step out of the race, just to be very clear. I know there's a lot of coverage on this race, but it was my decision and my decision alone. I looked at our supporters. You know, I led a canvas kickoff the day before. The day before was the 4th of July. We were at a number of parades, and there were people who poured their heart and soul into this campaign. I mean, when I turned in my signatures to get on the ballot, I was teary-eyed. I get teary-eyed thinking about it now, the number of people who believed in it. And I looked at some internal polling and kind of what our fundraising looked like. And if I didn't see a path, I'm the type of person, I'm not going to ask you to come out for another 3-hour shift and knock on doors if I can't be honest with you about where we're going to end up. So that was my decision, was to be able to step out on my terms for my team and make sure we win in November.
I see you getting emotional right now talking about this. I mean, I'm gathering this was a hard decision for you.
Oh, the hardest decision I've ever made. Absolutely.
What's next?
I don't know. You know, my goal now is to help great Democratic candidates win in November. I had started a state PAC back in 2022. After I had a speech go viral, I supported a dozen candidates running for state Senate and helped flip the Senate for the first time since 1984. I supported another dozen candidates in the 2024 cycle for State House. I'm going to do that again for this cycle. So you will see us relaunch that effort very soon, announced our slate of supported candidates. I love supporting good people and getting out and leading canvas kickoffs and encouraging people to stay in it, because I know the onslaught of news can feel so depressing. But this is Michigan. We have the unique ability as a state to change the course of this country, and we can do it from the ground up. And that's what I'm doing next through November. And then we'll see. I've got 4.5 months left in the state Senate and want to make sure that we go out on a good note.
Going into August 4th, the polling average had El Sayed ahead by 13 points. He won by 1 point. You spent a year more arguing that Democrats need new leadership and a different way of talking to people. What do you take from a close win like that?
It's so close. And what I saw in the results here, you know, there was all this pressure and coverage on Michigan to be the state that determines which direction the Democratic Party is going. Is it going progressive and outsider, or is it going establishment and experienced? And in the most Michigan way possible, we rejected the premise. And what we saw was in the Republican side of the primary, there were 900,000 Michiganders who voted in that primary. On the Democratic side, 1.5 million people showed out and voted. And it was almost even between the Congresswoman and Dr. El Sayed. And that, to me, is exciting. The more that I've sat with that, it says we actually have an opportunity at a moment when the Democratic Party has been wildly unpopular to grow it. We have to look at these turnout numbers. And it wasn't just in the primary, but it was also at the Democratic convention in our state back in April. We had a record number of delegates show up, register as Democrats, participate in the process. College Democrats outnumbered some of the unions. And for all the hand-wringing about why aren't young people participating, they are. And I think the biggest mistake that we could make right now as a lifelong Democrat would be to try to choose one direction or another. So I'm excited about that. To me, it says we are growing. That means that there are going to be some growing pains. We got to figure out how we all work together. But if we take a step back and figure out why we're all Democrats, we all want people to have health care. We want to end endless wars overseas. We want people to be able to afford to have a good life with just one job. And there's a lot more that unites us than divides us. And that's what I take with me about the election results.
Last one. When you got out in July, you wrote that you started this work 10 years ago, heartbroken, typing 5 words into a search bar: how to run for office. What would you type now?
Well, that's a great question. And for anybody listening, just know I had never done this before. I had never worked on a campaign. I didn't work in politics. I didn't come out of a political science program. I'm an industrial designer. I used to design Hot Wheels cars. Anybody can do this work. And what I would type now is, where do I go next? And that's what I'm figuring out over the next few months.
Mallory McMorrow represents Michigan's 8th Senate District, Royal Oak, Ferndale, Berkeley, and part of Northwest Detroit. She's Majority Whip of the State Senate, and her term ends this year. Senator, thank you so much.
Thank you.
McMorrow on WDET. I'm Robyn Vincent. Coming up, Muslim Americans have been making a lot of gains in politics over the past year. That's drawn a backlash in the form of Islamophobia. Next, we'll talk about why hatred toward Muslims has been reaching a fever pitch and why it came to Dearborn last night. Dearborn Mayor Abdullah Hammoud will join me in the studio. Stay with us.